Yeah, I can hear you. We can see
Oh,
you. Please share your screen.
yeah,
He's going
yeah.
to talk to us about how to deal with work, relationships, and academics during your residency. I think a very pertinent topic.
Ma'am,
Go ahead, Dr.
is the screen visible, ma'am?
Yes.
Okay. Uh, Good morning, everyone. Uh, my topic I would like to discuss about how to balance work, relationships, and academics during your residency. So, first of all, it's a very casual and very important topic. And I myself, uh, I did my diploma from RIO Vinto, and currently I am a second TNB resident at Arvind Eye Hospital, Pondicherry. And I would like to thank Apurva ma'am and Digvijay sir and our entire AIOS and UOC to give me the opportunity to talk today. Uh, yeah. Yeah. Uh, See, first of all, I'd like to say that this life is all about balance. So we need a balanced journey to sail through the challenges of era, which changes from time to time. So as a resident, there are a lot of things which we face, and I myself I am a resident, so I know what are the common problems which my colleagues and which my other friends are facing. So uh, the
It's
here
not running in a presentation mode. Could you run it in the slideshow mode? It's
yes sir.
currently showing as a slide navigation mode.
Uh, so the slides are changed.
So
Is
this
it?
was an issue yesterday also. I think you can go ahead like this only. It's fine.
Oh,
Okay, then proceed. It's showing a slideshow on your slide, then that's fine. Just proceed. Maybe some issue. Yeah.
okay. So, first of all, there are three things which our resident, any resident actually should balance, and currently, and it's always a problem, like to balance how the work pressure in the institute and the relationships and the academics. So many of the residents face this usual problem during their residency. So one by one, we will just like to pick up the the balancing sectors. And first of all, I'd like to talk about the work. So basically, I'm just dealing with each and every point one by one. So according to me and most of the people during the residency, we have to be very dedicated and honest towards our work, and we should not consider it a pressure, because so many residents they tell me, or they many of my friends also they tell that it's a work pressure and we don't enjoy it. So like, first of all, we should enjoy our field, enjoy our work, and then we can really we can really face the pressure during the work which we face. And there is always a complaint about the seniors and juniors, like they're not what you call they're not working in symbiosis. In many of the institutes, the so many seniors and even the juniors are not very friendly. So first of all, if this is the situation, they have to sort it out together, or there has to be an atmosphere which has to be created, which is useful for entire batch or the entire postgraduates. So there should be a need of a proper channel and understanding between every one of us. And so many residents they complain about the work given to them. They tell that they are mostly given the clerical work or the written work or something like that. They are like devoid of being given a surgical chance or something. So if this is the situation, first of all, every work is important. First year, second year, and third year, everything is divided according to the. It's a tradition. Like, see, everything we have to learn. But even the clerical work is most important. How to write the sheets, OPD sheets, how to record, how to see the patient and recording. Everything is important. And then gradually, the residents are given a chance to move on the surgical side. So, but so many residents they just want to neglect this and only crave about or mainly complain about the work given to them. So everything has to be learned, whether it's a recording, clinical work also, or your even the seeing the patient also, and the surgical part also. So gradually you will move on to that. So this is how we should actually carry, or we have to create a work atmosphere so that it is good for entire institute. So now, how to next come on to the relationship. So now what happens? This is a very important, and but so many residents face it. So, but the thing is, but majority of people think that it's too complex. So the thing is, it's all in our mind. So we have to bend. First of all, relationships doesn't mean that you have to be. Uh, it's with everyone. It's with family also, friends also, and even your close colleague also. And if you are married, even with your spouse also. So now this is the majority of people think that it's a too complex topic, but it's actually not. It's how we take it. So now here what happens is, now even your relationship with anyone during your residency. So and it should not, first of all, it should not affect your academics. That should be the most important. So we should always decide in which category it lies. If it is a fragile relationship or casual, or if it's a very serious or toxic. So we have to divert our goal according to that, because see, if the relationship is carrying you away from the academics, so always choose academics first. So this is a, everyone says that, and we should also follow this. So if given a choice, we have to prioritize our career first. So this is how we should, like, it's a very serious thing. So we should maintain relationships along with the academics. So many residents face it. So now, how do relationships come and go? Is it so? But that is a very casual talk. So we should not put this into the like how we channelize our growth. So the thing is that if it is important for your growth, if your partner is good, then very well ahead. Go according to, you can we can actually mutual, we can study and they can grow together. So it is not a very big thing. So come on to the acad. So people say that academics is a way to attract people. So, but according to me, first of all, that is always there. If you are good, then people will always ask you, they always praise you. But for ourselves also, it gives the essence of life. So first, it is always required to keep ourselves busy in a very good academic atmosphere, and we should always dedicate our time to study various these topics, and to keep ourselves busy. So this is what is very important. So now how to study, like my previous speakers have told everything, all the materials which is needed to excel in details. So but people think like own study and combined study, it all depends on them. So nowadays there are a lot of materials available all over. So people can study, like even the self study can also like lead, they can excel with that, and combined study with discussion is anyways fruitful. So and more important is good academics, and moreover a balanced academic along with your work. It makes you more confident in any stuff, like how you, even to deal with your professors, even to deal with your friends, it will show that confidence in your face and in your work also. So I would like to highlight some of the important things. With these points, I have actually asked so many residents, and then I have put it in a one very in a point wise. So people like who are in the residency, like me, so they have to, like, they can follow these things. So first of all, the self discipline is the most important. Self discipline means like how you prioritize your work and your academics, and even if anyone is in relationship, so they have to prioritize everything and they have to balance everything, and that too in a very disciplined mode. So first of all, in this thing we have to stop procrastination, and we have to involve ourselves in a fruitful thing. Okay. And later, this is exam time schedule, means the study schedule which people make near to their exam. So that is also very, very important. We have to jot down the points and we have to make it. And moreover, only exam time schedule is not very important. We have to be like into the study throughout the year. That is, we call it a whole year series along with your work. So it's most important that after duty hours, how you spend, how to spend the time. Most of the residents, okay, almost like more than 50% of the residents, they become so tired after duty. So they can't even study, they can't even like watch anything. I mean, obviously the duty is so hectic, so if people can't do that. But in this issue, we have to make ourselves very focused, and we have to create a plan in a week, at least something, or some days we have to give to our self study, or it's a or discussion with our colleagues, so that along with the work we can study also. So even if a resident can't study daily after duty hours, so he can actually spend it for 2 3 days or for 3 4 days in a week. He can make a schedule and do according to that. And most important, we have to keep ourselves involved in all the research activities and attend like entire whatever conferences and other activities also. And I already discussed with the other speakers that we have to keep, like, it's better to keep involved in publishing and to read various topics. So, and most like this avoid we have to avoid take any kind of nicotine, liquor, or watching explicit material. See, this is very uh, common thing. So because any kind of thing which divert our mind, so all we should avoid that. In fact, even we should avoid the negative people who do not focus on our growth, and who actually are jealous and try to divert us. So these are the things which we should actually uh, see that and judge, and according to that we should act. So what are the priority we should keep as a resident? So the thing is, we have to clarify our goals, what you want to achieve. And along with the study and all, there should be little time we should give to our exercise or practice yoga or any kind of meditation. And whenever we feel like depressed or something like that, we should watch motivational stuff whenever we need. And obviously we should not wait for that time. We should avoid procrastination. Whatever we want to do, we should do right ahead, whether it is related to whatever kind, like even our
Yeah,
work
Aditya,
also.
you need to wrap up, please. We have two
Yeah,
more talks.
and we should be always joyful, and that's why, and that will lead to our all-round growth. So thank you.
Thank you, Aditya. That was superb. It was very refreshing to see a resident having such, mature and concise and
Thank you.
quite succinct thoughts about such complex and broad topics. Thank you. Thank you for your talk.
Thank you, ma'am. Thank you.
So next,